Good afternoon, fellow CPOPers. It's Lauren, Blake, Drew, and Riley. Today we're going to talk about the field of long-term care pharmacy. First of all, what even is long-term care pharmacy?
According to pharmacist.com, a long-term care pharmacist is engaged by a long-term care pharmacy to provide pharmacy, infusion, education, consulting, and related services for a specific patient population.
For a better explanation of what that means, we spoke with Dr. Jeffrey Gray, a long-term care pharmacist who is also a professor at Gatton. Here's what he had to say about it.
Long-term care pharmacy is just as it sounds. It's for those who are traditionally in an institution, a facility, or some other type of living environment for a period of time. It's very much like you might expect in a traditional retail setting or community pharmacy setting, except the patients don't come to you. The patients don't call you. The nurses do. They call regularly, of course. And because of those sort of scenarios, it's really referred to as a closed-door pharmacy. The only people who come in and out of the door are the employees and the delivery people.
Dr. Gray explained to us that in long-term care, pharmacists serve patients that are in an institutional setting. This could be in a prison setting, a psychiatric facility, nursing homes, or assisted living, with the largest demand being in geriatric settings.
Dr. Gray works with geriatric patients. He explained to us why that field of pharmacy is crucial for our aging population and why he entered the field himself.
So one of the reasons that I entered geriatrics was because, and of course I did so 20 years ago, but there are large numbers of individuals who need to be served. And actually right now, this particular year, the last thing I read was there are approximately 10,000 people turn 65 in the United States every day. Well, guess what those individuals are going to need in about 15 or 20 years? Pharmacists who specialize in geriatrics. I very much love older residents. Pharmacists have an opportunity to serve older patients in a way that's probably, unique to most other populations, simply because of the amount of medication they're on and burden, the potential for adverse events and all kinds of other issues that occur with their medications. I tell my students that are working with me, my APPE students in fourth year, that the plan is not to increase or expand the patient's med file. Our solutions are in most cases are to reduce by 20 or 30%.
So now that we know what the general meaning of long-term care pharmacy is, how do you go about entering the field? Is there any postgraduate training that is required for geriatric or long-term care?
It really depends on what the application looks like. If you're in more of a dispensing-focused role, then I wouldn't suggest that you would need any additional postgraduate training. However, if you're going into a role that is going to require some additional experience and some additional creativity in regards to the practice environment, then it very well may. So I don't know, maybe 25% have a postgraduate training.
Let's talk about the pros and cons of working in long-term care pharmacy. On one hand, the job pays well. The average income for a long-term care pharmacist ranges from $92,000 to $130,000 a year. Long-term care pharmacists also have the benefit of caring for lots of patients at a time, which can be highly rewarding.
Some cons include the stress of managing the medication for so many patients, so volume of work is pretty high. There is also an added stress of having a somewhat variable schedule, as you may not work a typical 9-to-5 day in some settings.
We also got Dr. Gray's input about the challenges faced in long-term care pharmacy.
But the challenges are much that you would see in other environments. In our long-term care pharmacy, it's not uncommon for us to handle 3,000 to 4,000 prescriptions in a day. And so all the things that you could imagine that would occur because of that many transactions and the traditional disruptions of a pharmacy, those are in many cases the challenges.
Knowing all of the information we've learned thus far, how do you know if you're the right kind of person to go into long-term pharmacy?
Is this field something that you would generally recommend for pharmacy students, or in your opinion, does it take a special person, I guess with special interests, in order to be successful in this field and really enjoy it? Or is it something that the vast majority of pharmacy students could do?
Every single student should have some experience and appreciate the intricacies of geriatric practice. I don't care where you're working, especially if you're working community or inpatient, well, anywhere. you're working anywhere, you're going to see older adults. So no matter where you work as a pharmacist, you really should have some appreciation for working with older adults, just because they're, the vast majority of the ones that you're going to care for.
And finally, what should a P1 student do now to prepare for a career in long-term pharmacy?
So a couple of things. Let's say any field. So my first suggestion to you is show initiative. If you have an interest in geriatrics or pediatrics or whatever it might be, show initiative. Go out, shadow, learn from those who practice in that environment. Study up on what the authorities are saying about that population, right? And then when you have the opportunity to work there, maybe that's in a position as an intern or maybe later as a pharmacist, you'll be better prepared.
Now, we'll be happy to answer any questions you may have.